Welcome back to my channel, guys. Please ignore my bra. Today's video is all about giving you guys the real raw truth about cerclage removal. I'm going to be answering every single question that I've received. Now this video is about cerclage removal and helping other moms that might be dealing with cerclage and high-risk pregnancy. So guys, if you're not dealing with a cerclage or high-risk pregnancy, this video might not be for you. But I am doing this for those moms who need it. So I took notes just so I don't forget any of the questions. And I recently got my cerclage taken out last week. So I'm going to be letting you guys know what to expect, what happens, and just giving you guys the truth about what it's like. So guys, the first question, are you under anesthesia when the cerclage comes out? So the short answer is no. They typically want to take it out in clinic with no anesthesia. I know it's scary because when you get the cerclage put in, you have a spinal and you're numb from the waist down. So when you get it taken out, you go to the clinic for a regular OB appointment and they take it out. Now if you're a woman who has a low pain tolerance, if your cervix is sensitive from just being pregnant, if you have other abnormalities that are causing you to be high risk, like fibroids, or your uterus is shaped differently and they cannot get it without you having severe pain, then they can schedule you for an OR appointment, which is operating room. They'll send you to the OR in the hospital and they'll give you a spinal which will numb you from the waist down and you won't have to feel any of the discomfort. This is just for women who can't tolerate the pain and discomfort of doing it in clinic. So you can, if you can't tolerate it, you can get an anesthesia. Does it hurt? Okay guys, I want to be honest with you. Does it hurt to get this cerclage taken out? Yes. It's very uncomfortable, but it doesn't last long. So the pain and the discomfort kind of go hand in hand, but I will say that the pain lasts for a few seconds, then it kind of stops, but you're uncomfortable pretty much the whole time just because of the procedure and what's going on. So I will say it can be painful and it's very uncomfortable. Yes, honestly it is. Now maybe some women don't think it is. I personally thought it was. And the last time I got it done with my daughter, it was uncomfortable. It was more painful this time. I'm not sure why. Do you go into labor right after your cerclage is taken out? Typically no. There's only 12 to 11% of women who go into labor after getting their cerclage taken out, like spontaneous labor. Usually the average number of days it takes to go into labor once your cerclage comes out is, they'd say, 14. I can also agree with this because when I got my cerclage taken out with my daughter, I went into labor 13 days after. So I think about 2 weeks after you get your cerclage taken out is when you probably would go into labor. Once again, every woman is different and you might not go into labor after 14 days. You might go sooner. You might be one of the 11% who go into spontaneous labor right after. It just depends on when you got the cerclage. Was it preventative? Was it emergency? Did your water break? You know, it's a lot of different variables, but if you had a pretty uneventful pregnancy, you got a preventative cerclage, it should be about 2 weeks, but you just never know. Okay, does the cerclage removal cause contractions? For me, it did. So they open you up, they go through the whole process, but when you're getting your cervix manipulated during a pap smear or a checkup, it can cause contractions, which is one reason why they don't want you to have sex if you have a cerclage and you're at risk for preterm labor, because cervical manipulation, sex, all those things can cause contractions, and that happened to me. So she took it out. After she took it out, I had contractions during, and then she did this painful cervical exam and that really kicked off my contractions. So after the appointment, on the ride home, I had contractions, and from about 6 p.m. till 12 a.m. the contractions got worse, and then they kind of tapered off the next day. So it definitely can kick off the contractions and they can be pretty painful, but they should stop after a few hours. Okay, let's get into the cerclage removal process. What is it like? Okay, I'm gonna show you guys the tools right now. So I'm gonna cut the video, show you guys the scissors, the speculum, all those things, and then I'll come back and finish talking. So guys, they open you up first using the speculum. Then they use these scissors, which they put inside of you to snip the cerclage, which is the stitch around your cervix. And I'm 36 weeks tomorrow, so they're gonna go ahead and do a GBS swab, which is what this is, to make sure I don't have GBS, which can really affect the baby if the baby was to catch it. Okay, I'm back. Okay guys, so they use the speculum, which I showed you guys in the video in the doctor's office. First, they open you up all the way to your cervix because they need to see the stitch, which is all the way up your vagina to the cervix. That's where it's at, like right before your uterus. So that part is pretty painful because they have to open you up wide enough. That was the worst part. That was the most painful part for me. Once it's open, they lock the speculum in place and they put something there. You feel pressure, like something's being pulled. I didn't see it, but there's definitely something going on. That was a little uncomfortable. So once you're opened up, the speculum's locked in, they take those scissors that I showed you guys in the office and they slide it up and they put the blade between your cervix and the stitch and they cut it. This part was pretty painful to me just because your cervix is sensitive and you can feel the blade pressing on it, and pregnancy just makes your cervix really sensitive. But it doesn't last long. It was only a few seconds. The painful parts usually only last a few seconds. She cut the stitch, she pulled it out, and then it was over and she took out the speculum and everything. Now the next part, to make sure that my stitch was out, she actually stuck her whole hand up into my body and had to like physically feel my cervix and feel around to make sure all of the stitch was out. Now this was painful and pretty uncomfortable. I'm gonna say there was a few painful moments when she was really pressing it, and then it was just mostly very uncomfortable. That was the part that really kicked off my contractions, like really like sharp contractions in my side. After she checked to make sure it was gone, she pulls her hand out, everything was good, and it was over. I was just so thankful it was done, and all I had to do now was wait for my son to get here. Okay. The good news is that once your cerclage is removed and everything goes well, baby's good, you are allowed to have sex. They take the cerclage out typically at 36 to 38 weeks. At 37 weeks, I was told my baby is pretty much considered full term. He's healthy, so there's no more cerclage. You're allowed to have sex, but just be aware that this can kick off contractions or labor. But if that's what you want at 37 weeks, or you're just over it, you know, go for it. Everything is good. Baby's healthy. You've made it this far. The cerclage did its job, so everything is all good. So I hope that I answered a lot of you guys' questions, like what to expect, the removal process, how it feels. If you can make it through it in the clinic, I definitely recommend it. But if you can't, if your cervix is really sensitive, there is no shame in asking to be seen in the OR, in the operating room, and getting anesthesia, just to make it easier for yourself. But guys, I'm in the home stretch. I am 37 weeks this Friday. The stitch is out. Baby boy is healthy. So, you know, I'm very thankful because I know that in the beginning of my pregnancy, I was very nervous. I was anxious. I had bleeding. I was deciding whether or not to get the cerclage or just wait it out and see what would happen. I'm so thankful that I got the cerclage. It took a lot of worry off my mind. It did its job. My baby stayed in. No contractions this pregnancy. No preterm labor. Yeah, everything was really good. So we're thankful to God that it all worked out. And I hope that my videos have helped other women and just let you guys know what to expect, because that's the whole purpose of this channel. Part of my purpose was to just share this experience with you and not let my discomfort or my pain be in vain. So I hope that these videos really help you guys and let you guys know what to expect. So I wish you guys all the best. If you're a high-risk pregnancy mama, good luck to you. I'm praying for you guys. If you have any more questions, you can leave them in the comment box below. Let's encourage each other and uplift each other. And I wish you guys all the best, and I will keep you guys updated.